Vitamin B12, also known as cobalamin, is an essential water-soluble vitamin that plays a fundamental role in DNA synthesis, red blood cell production, and the maintenance of the nervous system. Despite being available in various animal-based foods, vitamin B12 deficiency is surprisingly common due to factors such as malabsorption, dietary restrictions, and age-related decline. Deficiency in vitamin B12 can lead to severe health consequences, ranging from neurological impairments to cardiovascular problems. Early detection is crucial, as prolonged deficiency may result in irreversible nerve damage and cognitive decline. This guide provides an in-depth understanding of the causes, symptoms, and effective strategies to prevent and treat vitamin B12 deficiency. The role of vitamin B12 in the body. Vitamin B12 is crucial for multiple physiological functions, including 1. DNA synthesis and cell division. Vitamin B12 works alongside folate in the process of DNA replication, which is essential for proper cell growth and division. Deficiency disrupts this process, leading to megaloblastic anemia, a condition where red blood cells become enlarged and ineffective in transporting oxygen. 2. Red blood cell production. Without adequate B12, the bone marrow fails to produce healthy red blood cells, leading to anemia, fatigue, and weakness. This deficiency reduces oxygen supply to tissues, affecting overall energy levels and physical performance. 3. Nervous system function and myelin sheath protection. B12 is vital for maintaining the myelin sheath, a protective layer around nerves. When B12 levels drop, the sheath deteriorates, leading to nerve damage, tingling sensations, and coordination problems. In severe cases, untreated deficiency can result in permanent nerve damage. 4. Brain health and cognitive function. Vitamin B12 supports brain function, neurotransmitter synthesis, and cognitive health. Deficiency has been linked to memory loss, brain fog, confusion, and even an increased risk of neurodegenerative disorders like Alzheimer's disease. 5. Energy production and metabolism. B12 plays a crucial role in converting food into usable energy. A deficiency can result in persistent fatigue, muscle weakness, and overall reduced endurance. 6. Cardiovascular health and homocysteine regulation. B12 helps regulate homocysteine, an amino acid linked to an increased risk of heart disease and stroke. Deficiency can lead to elevated homocysteine levels, contributing to blood vessel damage and cardiovascular complications. Causes of vitamin B12 deficiency. 1. Dietary insufficiency. Since vitamin B12 is primarily found in animal-based foods, individuals who follow vegan or strict vegetarian diets are at a higher risk of deficiency. While fortified foods and supplements can help, those who do not actively monitor their B12 intake may develop symptoms over time. 2. Malabsorption disorders. Even if dietary intake is sufficient, some people cannot properly absorb B12 due to conditions such as 1. Pernicious anemia, an autoimmune condition that prevents the absorption of B12 by attacking intrinsic factor, a protein necessary for absorption. 2. Celiac disease and Crohn's disease. These conditions damage the intestines, reducing their ability to absorb nutrients, including B12. 3. Atrophic gastritis, a condition common in older adults where stomach lining inflammation reduces acid production needed for B12 absorption. 3. Medications that deplete B12 levels. Certain medications interfere with B12 absorption, including 1. Metformin, used for diabetes. Long-term use reduces B12 levels and can contribute to neuropathy. 2. Proton pump inhibitors, PPIs, and H2 blockers. These acid-reducing medications lower stomach acid, which is necessary for B12 absorption. 3. Certain antibiotics. Some antibiotics can disrupt gut bacteria essential for B12 synthesis. 4. Aging and reduced stomach acid production. As people age, stomach acid production declines, which can reduce the ability to extract B12 from food sources. This is why older adults are often advised to take B12 supplements or consume fortified foods. 5. Alcoholism and liver disease. Chronic alcohol consumption affects the liver's ability to store B12 and impairs absorption by damaging the stomach lining and intestines. Liver disease also depletes stored B12, increasing the risk of deficiency. 6. Pregnancy and increased B12 requirements. During pregnancy, the body's demand for B12 increases to support fetal development. Pregnant individuals who do not consume enough B12 may experience deficiency, which can lead to complications such as neural tube defects in the baby. Symptoms of vitamin B12 deficiency. 1. Fatigue and weakness. One of the earliest and most common symptoms of B12 deficiency is extreme tiredness, even after adequate rest. This occurs due to impaired red blood cell production, leading to reduced oxygen delivery to the body's tissues. 2. Neurological symptoms. 1. Tingling and numbness, paresthesia, in the hands and feet due to nerve damage. 2. Balance and coordination issues, making walking or standing difficult. 3. Memory loss and cognitive decline, often misdiagnosed as early signs of dementia. 4. Depression and mood swings, as B12 is involved in serotonin production. 3. Oral and tongue abnormalities. 1. Hunter's glossitis, a swollen, red tongue with a burning sensation. 2. Mouth ulcers, painful sores on the inside of the mouth. 3. Xerostomia, dry mouth, a result of reduced saliva production. 4. Gastrointestinal symptoms. 1. Bloating and gas due to poor digestion. 2. Diarrhea or constipation resulting from disrupted gut function. 3. Loss of appetite and weight loss in severe cases. 5. Cardiovascular symptoms. 1. Increased homocysteine levels, contributing to heart disease and stroke risk. 2. Shortness of breath and dizziness, due to anemia-induced oxygen deficiency. 6. Muscle and mobility issues. 1. Cramps, spasms, and muscle weakness, making daily activities more difficult. 2. Loss of sensation in extremities, leading to unsteady movement and frequent falls. 7. Erectile dysfunction and sexual health issues. Vitamin B12 plays a role in nerve function and blood flow, and deficiency may contribute to erectile dysfunction and reduced libido. Solutions. How to prevent and treat vitamin B12 deficiency. 1. Increase dietary intake of B12-rich foods to ensure adequate levels, include 1. Animal products, beef, liver, poultry, fish, salmon, tuna, trout, eggs, dairy. 2. Fortified plant-based foods, cereals, plant milks, and nutritional yeast for vegans. 2. B12 supplements and injections for those unable to get enough B12 from food. 1. Oral supplements, available as tablets, lozenges, or sublingual drops. 2. Injections, recommended for individuals with severe deficiency or malabsorption issues. 3. Address underlying medical conditions. 1. Treat pernicious anemia with lifelong B12 injections or high-dose supplements. 2. Manage gut disorders such as Crohn's or celiac disease to improve absorption. 3. Adjust medications that interfere with B12 levels, under medical supervision. 4. Regular testing and monitoring. 1. Routine blood tests to check B12 levels, especially for at-risk individuals. 2. Monitor homocysteine and methylmalonic acid, MMA, levels, which can indicate early deficiency. 5. Lifestyle adjustments. 1. Reduce alcohol intake, as excess alcohol impairs B12 absorption. 2. Improve gut health by maintaining a balanced diet and staying hydrated. Vitamin B12 is a fundamental nutrient essential for energy production, brain function, nerve health, and red blood cell formation. Recognizing deficiency symptoms early and implementing dietary or supplemental solutions can prevent severe health complications. Regular monitoring, especially in at-risk populations, ensures long-term well-being and optimal functionality.